Sue will be on in just a second. I don't think she was put on as a panelist.
Awesome. And we are in the live session. So, Sue, whenever you're ready, feel free to take us away.
I apologize for the little technical glitch there, but we're on now and we're ready to go. And good afternoon, and thank you for joining us for the 4th Annual Delaware County Sustainability Conference. My name is Sue DiPompio, and I am the Assistant Director of Sustainability Finance here at the County of Delaware. I will be serving as your host this afternoon, providing important information to ensure that your experience is both, I apologize, to ensure that your experience both in today's session and throughout the rest of the week leaves you feeling informed and inspired. To begin with some housekeeping items, this session will take place in a Zoom webinar format, meaning participants will be off camera throughout the duration of the presentation. Questions are encouraged and will be addressed following the presentation. To ask a question, you may either type it in the Q&A box found at the bottom of your screen, or click the raise a hand button if you would like to ask your question out loud. Questions will be answered in the order in which they were received, or if we see multiple questions of a similar nature, we will bump those to the front. We do our best to ensure that all questions have been answered. However, we will be ending the session at the top of the hour. Now, to kick off our session, we are very excited to welcome Lora Siegmann Werner, Shannon Dade, and Dr. Kristen Motley, who will share their presentation, Our Home, Our Health, Understanding and Acting on Environmental Exposures in Delaware County. Lora Siegmann Werner, MPH, joined us here in Delaware County in April of 2022 as the Deputy Director for the newly formed Delaware County Health Department. Prior to serving the county, she worked at the federal level as Regional Director for the Agency for Toxic Substances and Disease Registry Centers for Disease Control and Prevention, and with the Preparedness Division of FEMA, the Federal Emergency Management Agency, Region 3 in Philadelphia, Pennsylvania. She has over 20 years of experience directing responses to chemical exposure and public health concerns and building partnerships across Delaware, the District of Columbia, Maryland, Pennsylvania, Virginia, and West Virginia. Shannon Dade is the Healthy Homes Program Specialist at the Delaware County Health Department. She holds a master's in clinical counseling and is pursuing her master's in public health. In her role, she assists with efforts to prevent lead poisoning and improve housing conditions through partnerships, policy changes, and community education. She brings a strong background in mental health, public health programming, and administrative leadership. As a passionate advocate for health equity, Shannon is committed to building sustainable systems that serve vulnerable populations. Her background in mental health and public health informs a holistic approach to addressing social determinants in health, including the crucial role of environmental safety in childhood development and overall well-being. Raised in Delaware County, Shannon is driven to advocate for safe housing, quality care, and the support needed to meet the physical and mental needs of individuals working to close the gap in health disparities and create a more equitable future. And Dr. Kristen Motley is walking in her purpose and with passion on a mission to educate and empower the community. Dr. Motley has built a reputation for herself as a committed pharmacist who has a vested interest in the health of the community. Born and raised in Chester, Pennsylvania, she graduated with honors from Florida A&M University with a Doctor of Pharmacy, and from the University of the Sciences with an MBA in Pharmaceutical and Healthcare Business. Dr. Motley is the founder and executive director of Health Educated Incorporated, a nonprofit organization that works with healthcare providers and community members to address health inequities, eliminate health disparities, and promote health literacy, particularly in underserved communities. She is also the compliance coordinator and field supervisor for the Philadelphia College of Pharmacy at St. Joe's University. Please join me in welcoming our impressive panelists, and I turn it over to Laura.
Thank you, Sue. We are thrilled to have you all here. We heard a rumor that we may have had the highest sign-up registrations of any of the sessions in the conference, so yay for all of you. I just want to open it. Shannon, Kristen, and I, we're public health officials. We're not, engineers or industrial hygienists, so we may not know every detail of a home air conditioning heating system, but we did our best to research with a lot of experts and really want to share with you what we learned today. So thank you so much. All right, next slide. I'm going to quickly go over our agenda. We're going to talk about, what is a healthy home? What are the common environmental hazards you might find? How to see them and locate them in your home, and how then to do things about it. And then we'll close with Kristen and her roadmap for addressing environmental hazards in the city of Chester and some available resources that we'd like to leave with you. All right, so this is the one interactive part of our presentation. We really want to hear from you all. What words come to mind when you hear that phrase, healthy home? And Shannon's putting up right now, if you have a phone, hold it up and scan that QR code. It'll give you an opportunity to just type in words of what, what's in your mind, what healthy home says to you. All right, so let's see how it works. I'm going to do it too. We'll give it a couple of minutes to start populating. Yeah. Fresh air, clean air. Yeah, all of those. Natural, non-toxic, safe, healthy pets. Oh, yeah, I love these. Oh, houseplants, another good one. Warm and cool as needed. Oh, yeah, you guys are going to be right on with the stuff we're going to be sharing. I love it. All right. Well, it seems like it kind of slowed down. So I don't know. Why don't I go ahead? Thank you for everybody for doing that with us. And I think we might have got a couple more in there. Green space, substance free, safe, clean. I think it makes bigger if lots of people are repeating that word, or phrase. So it's even better. Dry. Oh yeah. Effective trash removal. Don't burn methane. Safe for children. I don't want to cut this off. This is so good. All right, but Shannon, we better keep going because I know we have a lot to go through. All right, thank you, everybody.
Hi, everyone. Thank you so much for having us. As Laura pointed out and said, my name is Shannon. I'm the Healthy Homes Specialist with the Health Department. So you guys had some great answers in there. I wrote down a few: clean air, mold-free, healthy pets, all great things. And so just a very short definition: a healthy home is one that's intentionally maintained to prevent injuries and illness for the occupants within the home. It's safe, it's well ventilated, it's free of harmful substances. And we're going to go over a few ways to ensure that your home can remain safe, and just what you can do as well. And so they're not just nuances, they also impact your health. Sometimes we think of like lead-free and mold-free as maybe suggestions, but they do have health impacts when we don't consider them. So environmental exposures, here's just a list of some of the major culprits that we are going to be going over, and we can't get to all of them, although we wish we could. But we have lead here with a picture of peeling paint, noise, indoor and outdoor pollution, radon, which you can't see, you can't smell, you can't taste it. Mold and mildew, rodents and pests, asbestos, and drinking water as well, just to name a few that may ring a bell for you or not. So because we're in Delaware County, we thought it'd just be good to be aware of some of the county-specific concerns that we may encounter because we do have older house stock. So that may cause issues regarding lead, industrial emissions in concentrated areas, highway and rail traffic corridors impacting neighborhoods, and rising sea levels. And as I said, we may not be able to address all of these today, but these are things that hopefully in the coming future at some point, Delco, we are working on as well. So here's just a few questions. How to identify hazards in your home. How do you know if your home is safe for you? You may not even know what to look for, what to look for or how to know. So these are just some screening questions. Of course, there are others. But was your home built before 1978? This may be an indicator that you may have lead-based paint in your home. So you may need a lead inspection if you haven't had one done before. Do you see signs of mold and mildew or smell musty smells or notice any respiratory issues within yourself or even your family members or your pets? These could be tell signs that there may be some hazards in your home. And so this may be an opportunity for you to begin to investigate and, have the proper inspectors come in or get test kits for yourself to ensure that your home is safe. So here we have what we consider the 8 principles of healthy homes. And this actually is from the U.S. Department of Housing and Urban Development. And it's widely recognized as just a foundation for a safe home in a healthy environment. And what Laura also mentioned is called the keep its. So there's just 8 here. You can screenshot this. You will also have access to these slides after, but if you just want to screenshot it, if you're on a device that can do that. But keep it dry, keep it clean, keep it safe. So that means like poison-free, especially with children. Keep it well ventilated. This helps reduce mold, especially for like bathroom and basement areas. Keep it pest-free. Keep it contaminant-free. Keep it well maintained and keep it thermally controlled. And so this is just a few things that you can do. You can begin to work on. Take one, start working on it, and then you can go from there. So the first hazard, excuse me, that we're going to be discussing is lead. And so lead is especially dangerous for children. As I mentioned before, it tends to be in older homes, and Delaware County has a large population of older homes. And so with the homes being built before 1978, when lead paint was still legal to use, it could cause a lot of issues. So you might see lead-based paint, it might be peeling, it could be in the pipes, it could also be in the dust and soil, and dust within your house or outside of your home or even the soil. And so some of the issues and why it's so important, it could cause developmental delays in children, behavioral problems, brain damage, causing a lowered IQ, kidney and nerve damage, high blood pressure, reproductive issues in mothers or individuals that can bear children. And so because of that, some ways to help prevent it is wet cleaning methods. So instead of necessarily, not saying don't sweep your home, but using more wet cleaning, because the lead particles, they can fly through the air and it's get into your system a lot easier. So by using wet cleaning methods, a HEPA vacuum, which is not just a regular vacuum, and it's a special filter that captures about 99% of the dust particles compared to a regular vacuum that you might see it. You might vacuum in your home and then you see some stuff flying out. So a HEPA vacuum will not do that. And then painting over chipping paint, and even using a specialized paint to contain the paint. And then washing your hands and toys regularly. Children are most susceptible. So if you have a child of especially 5 and under, washing their hands, they're putting everything in their mouth, washing their toys, plumbing as well, as I mentioned before. It could be in the old pipes. Replacing plumbing, which we know that can be pricey, but if it's in your water, it might be necessary. And then asking about lead when buying a home. I know a lot of municipalities in Delaware County, when you purchase a home, they provide like information so that you're just aware of it. But if you have a large packet, you're just moving, you may not even be thinking about lead. So now hopefully this can be on your radar to look out at. And because it is such an issue in Delaware County, we have a program, we have so many initiatives taking place within the county, Chester, and so many coalitions to tackle the problem and the issue of lead, especially in children. So please reach out to us. We have so many resources that we can assist you with, especially if you have a kiddo in your home under the age of 6 years old. And so how can you check? You do need to hire a certified lead inspector. They do have home testing kits, which can help, but they don't always capture everything. So hiring a certified lead inspector, and if you have questions about that, I would be the person to help you. So please do not hesitate to reach out to us. So the next one that we're going over is mold and moisture. This might perhaps be a little bit more familiar for some, and it does tend to be more visible. You might smell it, you might see it. You may see it in the bathroom, under your sink, perhaps, in spaces with leaks, or in the basement, or something like that. And so the impact, you could develop a sore throat, wheezing, burning eyes, skin rash, congestion. You could even be allergic to mold. And also the thing is, you may not have any of these symptoms, but it could still be impacting your health or the health of your loved one. So keeping indoor humidity low, using a dehumidifier is awesome. You can purchase one online or even in the store. Fixing leaks in your home, so the roofs, the walls, the plumbing, and doing it quicker. So you might know there's a leak and you might, oh, okay, I'll fix it later. But mold can develop within like 24 to 48 hours. So you want to make sure you're tackling that. And if it's persistent and you're not able to fix it, having someone that is certified or knows how to fix that come into your home to ensure that it's not going to create a larger problem. And then you perhaps develop health effects, I'm sorry. Using an exhaust fan in the kitchen and the bathroom, similar to using a dehumidifier, and removing items in the home that have been soaked but have not dried properly. So you may have a flooding issue, perhaps in your basement. And so let's say everything got wet, but you didn't move it out right away. Check the bottom of those boxes, maybe the bottom of the furniture, just to see if there's any spots or anything developing, so that you could definitely handle the mold, because it does impact your health. And then how can you check for mold? The great thing about mold, which is, although it's not great, you can often see it. So you can have a mold inspection. However, oftentimes you can see it or you can smell it. There's discoloration as well. So if you see it, let's talk about it and hopefully address it.
Thanks, Shannon. Like I said, we were just doing a kind of walk through of a selection of those hazards that we mentioned earlier. So I have a couple and sheet a couple. I wanted to talk about radon. Radon, like Shannon mentioned earlier, you can't see it, you can't smell it, but it is a common problem here in Delaware County homes. And the health issue, I mean, this is the #1 cause of lung cancer among non-smokers. And if you are a smoker and you also have a concurrent radon exposure, you have a 10 times greater risk of developing lung cancer compared to a non-smoker. It just is a silent risk for your lung health, and it's worth it to check and see if you have it and address it if you do. Systems can be rather involved, or they could be smaller solutions that can include sealing cracks in your floors and walls. You just don't know until you check. And then you see what your problem looks like, and then you design a solution around that. There are free radon test kits that you can do to screen initially. There's the final slide we have on resources has where you can sign up to get one mailed to you for free. You can also have your home tested by a licensed professional. And this is really definitely an issue in lower floors, most of all. And if you're going to be doing some renovations and repairs, particularly if you're going to be turning a basement into a livable space, it really makes sense to check. Next slide. This is some information I just wanted to share so you could see. I mentioned this is a common problem here in the county. The Pennsylvania Department of Environmental Protection has a radon program and collects radon test results from across the Commonwealth. That's on the right there. I probably left and right. Yeah, on the right. You can see the link where I pulled this from. You can put your zip code in. I did for mine, and you can see all of the test results for that zip code by basement and first floor. And there's a company called Air Check, I think it was, that took this data from the state and summarized it by county. And you can see there in the pie chart that of all the results from Delaware County through May of this year, a quarter of those were in the red. There were results that were 4 picocuries per liter or above. That's the level of concern for radon in indoor air. So 25% of our homes that tested had a problem level. Another, I think it's like 23% had results that were between 2 and 4, which means you might want to think about, oops, we went the, thanks. So it's kind of in the maybe land. And then, half homes didn't have a result of concern. The results were under 2. So you might get lucky. You could check and you could be in that half, or you could be on that other side, and it would make sense to try to address that hazard. Okay, next slide. So radon is an indoor air quality problem. I also wanted to talk more generally about all the other indoor air quality issues that can affect your home environment and your health. It's crazy. We were doing the research for this presentation and saw that statistic that we all spend 90% of our time indoors. I mean, it's hard to think about it. I'm outside all the time, but really when you map it out, most of the time we're inside. And so that the air that you're breathing in your indoor environments, particularly our home, is really important. And to make it, the changes that you make to make it cleaner and healthier are going to be really valuable. And it's going to really be most protective for the folks that are particularly vulnerable to air quality problems. Those include the children, elderly, people with pre-existing health conditions in their lungs, like asthma and heart disease. But what causes the changes in your indoor air quality? It's pretty much a wide gamut of things. It can be any of the household products that you use to clean. It can be cooking. It can be smoking. It can be just your couches and furniture that can off gas from the building materials. I mean, it's your pets. All of this is affecting the air quality in your home. In addition to all those indoor things, outdoor air is also affecting the indoor air quality, and pollution that can be from the outdoors can get concentrated in the indoor space. So what can you do about it? Source control. There's the items that are producing the problems, at least inside your home, you have control over. Ventilation and filtration. All these things can help address these issues, and we'll talk about that a little bit more. How to check. I mean, this is an area I did a lot of work in my past career. Testing for air pollutants can be really expensive. And in general, we don't recommend that homeowners get into trying to figure out how many chemicals they've got in their indoor air space. It's really, it's more, other than radon, we really just recommend jump to the solution. You can do things to improve air quality without knowing exactly every minute quantity of which chemical is there. So, next slide. I consulted with my friend who's an industrial hygienist, and he gave me this analogy, which I really love. And for those of you with forced air systems that cool and heat your home, he's like, think of that. Think of your HVAC in your home as the heart and the circulatory system there in your household. It is pumping air through all the parts of your home, and it's your job to make sure it's in a balanced condition and healthy. So you need to give it a physical. You need to do things to maintain it. You can't just ignore it in the background and think it's doing fine. It needs your care and attention, and it'll pay off with making your indoor air quality in your home so much better. So keep all your distributors and returns open and clean, and change your filters. You can do them yourself. You can pay somebody to do it, but if you're doing it yourself, read what the specs are for your system, get the right filter for your system, and get the highest rating that it can take. Okay, next slide. And like my friend, he kept emphasizing, said, tell the folks that you're going to be speaking with, the absolutely best thing that they can do is to change those air filters regularly. You know, do whatever you got to do so that it's on your mind and you do it on a regular schedule. Got a lot of questions about, well, why don't we just open the windows, you know, and windows can work for temperature control, but they don't circulate the air in your home, and they will change the balance of how your HVAC system is working. So if you're trying to heat or cool your home with your HVAC system, don't have the windows open. Turn it off, and if the outdoor air quality is good and you want to freshen what's going on, great, open your windows. But again, your system is distributing what's inside your home. And generally, what's inside in your air can't get much better than outside where it's coming from. So it really is really vital to keep track of what is inside your home and control what you can, like some of the things that Shannon was saying about making sure you're addressing mold and moisture. You know, maybe one of the more important things you can do if you do have smokers in your home, try to encourage them to smoke outside. These things really do. And using your filtration on the fans in your stove and in your bathroom, all those things add up. Okay, next slide. Again, those are, again, just kind of reemphasizing all these factors kind of interrelate together that we're talking about, you know, and keeping the humidity low, and then cleaning in the ways that Shannon was talking about, wet cleaning or with a HEPA vacuum, all those will help. And we really always want to encourage people to follow the available air quality alerts. And there'll be times when it's really very important to not open your windows, to keep the air inside your home better than what's outside. I took a screenshot from when I was at work the other day. All of us have such accessible air quality information now. It's right there. You're carrying it around in your pocket. You pull up that weather app. It's going to give you the air quality information that's helpful for you to know. Right, next slide. There's a lot of questions out there about portable air cleaners to improve the indoor air quality in your home and whether they're worth it or not. This is really a very personal decision, but if you do decide to go that route, make sure that you pick one that's properly sized for the room that you'll use it in. And please avoid the ones that produce ozone. Some of the advertising materials around ozone-based air cleaners will try to persuade you that their ozone is a clean ozone. It's not. It's the same chemical, and it's not healthy for you to breathe that in your indoor air space. Don't add it to your indoor air. I thought it was really neat that EPA had this DIY air cleaner that you can actually make yourself out of a simple box fan and some of these air filters that you can buy at any home improvement store. There's the link for all those instructions are there in the slide, but it can be very effective if you're particularly trying to protect a loved one, for example, in their bedroom where they have breathing difficulties, and you just want to find an inexpensive way to do that. Okay, next slide. So a lot of you are attending different sessions throughout the conference this week, learning about sustainability. And I just wanted to connect this session with that to say that all the things that you're learning in those other sessions, they not only affect our county's health as a whole, but they affect our individual household health as well. I mean, it's all interconnected. So by the things that you do to reduce your plastic usage, reduce the kind of toxic products you buy, that means less goes into the incinerator and the landfills that take our waste, which will then produce less impacts on the outdoor air quality that then is, you know, what we're all breathing outdoors and indoors. So just wanted to leave that thought in your mind that everything that you're doing is actually supporting the health of your home and your neighbors. Okay, next slide. All right, Shannon, back to you.
Thank you, Laura. So I don't know if you guys are thinking, well, how am I going to handle all of this? Like, how am I going to, you know, tackle everything in my home or encourage others to? And so the thing is, we want you to take action, of course, but doing it one room at a time. And so just taking it step by step. So in an older home, especially if you do have peeling paint, you do want to test it before you disturb it because scraping or sanding lead-based paint is extremely dangerous for your health. As we said, especially for children because they are still developing, but even for adults. So you do want to test that and then perhaps installing or requesting a radon test kit. Um, some spaces have them for free, so you can look into that as well. When it comes to air quality, changing those filters out in the kitchen, using an exhaust fan, especially if you're cooking with a gas stove, using ventilation because it could produce a harmful substance. And then in the bathroom or the basement, as we mentioned, fixing those leaks when we see them, once we find out, or if we smell something, just looking, investigating it a little bit to find out if there is mold or mildew. And then for pest control, sealing cracks so that you don't have to use harmful substances to keep them out, but maybe just sealing the cracks up or ensuring food is locked away safely and maybe in the refrigerator to keep rodents away. Just a few ways just to begin the process of keeping your home safe. And then we have this as well, which is from HUD as well, keeping your home safe and healthy. I love this. This is something you could, you know, screenshot as well, print out, put it somewhere in your home. And this just further encourages what we were discussing. And as I said in the previous slide, not everything needs to or even can be done in one weekend or in a short time span. So take your time with it. There are certain things that we do every day for our health and certain things we only do once a year for our health or maybe every few years for our health. So the same thing is for your home. And so if you know, doing a walkthrough of your home maybe every 6 months or once a year, just to see is there anything that I haven't looked into. Maybe you haven't gone into the attic since you moved into your house outside of putting storage up there. So just making sure everything is tidy and as it should be in your home, just like you do for your car. Replacing those HVAC filters every 3 months and then every 6 months, just walking the grounds and making sure deadbolts and locks are still working properly to keep you safe as well. So there's just several ways that you can do this, and we just wanted to encourage you. It doesn't have to happen all in a short time span. You can take a chunk at a time.
And I will pick up here. Thank you, Laura and Shannon, for laying the groundwork, discussing the environmental hazards, including lead and all the terrible effects of lead exposure, indoor air quality, outdoor air quality. I just want to talk a little bit about how that shows up in real life, in real people. Particularly in the city of Chester. So in addition to all the wonderful titles that were mentioned, I'm also the health commissioner for the city of Chester and really proud to have the opportunity to serve in this role. and to lead our public health efforts here. But we are dealing with old housing stock, just like many other areas in Delaware County. We are the location where William Penn landed. We are the oldest municipality in the county, in the Commonwealth. And a lot of our homes, most of our homes are very old, built decades and decades and decades ago. And so because of that, many were built at times when lead paint was used and lead pipes were used, and the lead is still there. We're also a long-time industrial town, which means that there are tons of heavy metals still around in the soil that gets tracked into homes, including lead, and that's a problem. We also have an industrial highway that I'm looking outside the window and see diesel fuel trucks and automobiles going up and down 291, and this is happening all day long. We have the Interstate 95 that runs through Chester as well in a different part of the city, and all the automotive emissions that comes from having that highway run through the Chester is impacting our air. We have passenger trains and freight train lines that run through the city as well, chemical plants, manufacturing plants with all of their emissions, the plane emissions that come from the Philadelphia International Airport. We have a oil refinery as a neighbor right in Marcus Hook Trainer. We are home to the county's Solid Waste Authority, and the emissions that come from there. We're also the home of America's largest trash incinerator, and all the emissions and pollutions that come from there. And there's also a crematory right in a neighborhood's backyard. And we get complaints of residents smelling toxic fumes, as well as black smoke coming out of there. So it is an environmental nightmare in Chester, really. And I would say that it shouldn't surprise you that we have our pediatric asthma rate is 4 times the national average. Our infant mortality rate is 5 times the national average, 3 times as worse as it is in Philadelphia. We have disproportionate rates of heart disease, cancer, chronic lung conditions, kidney disease, just all the things that you would expect to show up in a place that is overburdened with pollution. It shows up here. And then we have a nerve to have a hospital closed on us, as if we can survive in a community with no hospital with all this pollution. I'm not going to go down that road in this webinar today, but it is just unbelievable to me, the impact of pollution here and the lack of healthcare resources. But we can go to the next slide. So the way that I've been addressing public health, environmental health in this role, and you can hit play, Shannon, it's fine, it's on mute, so you won't be able to hear me, but this is just one example of how I've been, doing what I can do to advocate for the environmental health of Chester residents. One is through legislation. And so I had an opportunity, I was joined by Lora that day. We had an opportunity to speak at a House committee hearing regarding House Bill 109. I'll talk about that a little later. But that's the cumulative impacts bill that will require the Department of Environmental Protection to consider all the things that are burdening a community that is driving the environmental challenges of that particular community. I have been able to write comments to the Department of Environmental Protection when we get requests from companies to expand their permits. And so all I can do right now is write comments, because there's no regulation that would prevent DEP from permitting expansions, because the regulations don't exist, which is why House Bill 109 is so important, because all these companies are permitted like they are the only polluter in this area. Also working to enforce a lead ordinance that was passed in the city 2 years ago, and also being able to work with our licensing and inspections team to train the code enforcers on lead and collaborating with Chester Water Authority on some initiatives as well. You can go to the next slide. Thanks, Shannon. You did a good job with that video loop. Next, I want to talk about what we do at the residential level. We've created the Chester Lead Task Force, which was formed out of Swarthmore College and Swarthmore Black Alumni Network, who've been instrumental in helping to address poverty issues in Chester. And that task force has many members, including the health department and other organizations. And we are really getting out into the community to make sure that we're testing children for lead and but first and more importantly, educating the community on lead so that they know why it's important to get tested and that they want to get tested. Also, having residents tap into the resources available through Chester Water Authority and checking their water service lines and testing their water for lead. Also applying for grants to receive lead assessments, lead risk assessments, and lead remediation. I secured a $350,000 grant from Green and Healthy Homes initiatives. Unfortunately, we were told to get started on the projects, and then unfortunately, once the Trump administration was in office, the EPA blocked that funding, and so no one around the country, and I think they were distributing about $45 million around the country for environmental justice communities. No one is getting access to those funds now, and that money was going to be used to perform lead risk assessments and remediate homes where there were children, pregnant people, childbearing age people that have lead in the home. And so we can't do that work through that grant at this time, but I also applied for funding from the William Penn Foundation to do the same thing. And so we're hoping to hear back from them soon regarding that. And then that grant also includes some indoor air monitoring and air cleaning as well. Next slide. We are also engaging with the schools and the daycare centers to make sure that the teachers, that the daycare providers, the parents, that they also know about lead and environmental hazards, and to check their pipes, the schools and the daycare centers pipes for lead and testing their water for lead. There is a program through the state where that's available, and so we're taking advantage of that. Next slide. And so we're just showing up in the community wherever the people are. We are going to sporting events, again, schools and daycare centers, community events, any type of community festival. They don't have to have anything to do with health, but wherever the people are, we are showing up and making sure that we are engaging and educating so that people can make decisions on what to do and know what are the resources that are available. Next slide. And so in conclusion, I just want to say that when I started this role, it's almost been a year. I didn't have a roadmap. I didn't have say a guide. There was no one in this role prior to me coming, and so I'm not using the textbook. I'm not using any frameworks. I am just doing what I feel is right for the community in terms of helping them get access to resources, helping to solve these problems, using common sense as much as I don't know if that's a thing anymore, but just really, just trying to use the tools and the resources and the organizations to help me with this as much as I can. I am a Bureau of Health of one person, so it's just me in this department, but I have so many partners, including the county, the health department, the Foundation for Delaware County, Penn, like all the organizations around have been incredible in helping me carry out a lot of this work. The next slide. So the last thing I would say, I talked a little bit about House Bill 109. This is the cumulative environmental impacts bill. This will require the Department of Environmental Protection to consider all the polluters in an area before they approve new permits for new organizations or expanding operations, it would require them to consider all the other sources of pollution before they just approve an application. And I would say if you're in Pennsylvania, regardless of where you are, there may be an environmental justice community around you. This is not just a Chester thing. This is not just a Philly thing or a poor thing or Black thing. This is a problem across the Commonwealth. There are almost 2,000 environmental justice communities. Most of them are not in this area. They are in rural Pennsylvania. And so this is something that affects everybody. We all should care about this in the same way. And I've been in meetings where I'm hearing that this, although it has passed through the committee, I'm hearing that it may not pass through the House, and that is, it's just embarrassing if this doesn't get the movement that it deserves to get, because they've been trying to pass a bill or similar bill for a number of years, and it has not happened, and it needs to happen. So I just want to encourage you all to contact your legislators, let them know that it's important to you for them to vote yes on House Bill 109, so that we are not sitting here next year asking for the state to do the same thing that they could have done by now. So that concludes my talk, and here's our contact information. We'll be glad to answer any questions that you may have.
Yeah, and then if you could go to the last page too, Shannon, that has some of the resources that we've been talking about. While we wait for a question or two to come our way, we just definitely want to point out the Delaware County Health Department has a wellness line, staffed by, you can talk to a real person, not get stuck in phone tree hell, and they just are wonderful there. I really can't say enough good things about our call takers, and they will try to get an answer for you if it's something about a public health question and a healthy home question. So, and if it, like Shannon pointed out, if it's about lead, you'll probably end up talking to Shannon. They'll forward you to her. So that's how to reach our wellness line and our website. We also want to point out Delco Alerts in partnership with the county's Department of Emergency Services. There's a way for you to sign up both for emergency alerts, and also you can select that you're interested in healthy Delco and as one of the subject areas that you would like to get alerts about, and you'll get things that we might want to share out with you about health for the county. Then that healthy homes checklist and principles that we talked about, that EPA, some of those EPA links I shared for the DIY filter. There's soil testing kits that you can obtain through the Penn State Extension if you're interested in testing your soil for lead or other heavy metals, or just even for nutrients. Stuff about lead in drinking water, the radon test kits that we talked about, and lastly, the American Red Cross fire safety website has some great tips for you on fire safety as well. All right, that's all we had to say. Becca, Sue, do you have questions for us?
Well, what I'd like to do is thank you, Laura, Shannon, and Kristen. To me, you shared such important information, and I know that there really aren't a lot of questions right now. That tells me that you were so thorough in your presentation, you left no questions to be asked. So I applaud you on that. But please, this is such important information, folks, that you understand and be informed about. And I thank you for that. And I will turn it over to Becca. Perhaps she has a thought or a question.
Sure. So just for matter of the record, there was a question from an anonymous attendee who did ask how you can find out if your pipes have lead. And Dr. Kristen Motley did respond by sharing your water provider and/or authority should be able to help you with that. If you have Chester Water Authority as your water provider, you can call 610-876-3335. or email servicelineinfo@chesterwater.com. She also noted that Aqua provides the same service, but you would have to look for their local information.
And there's also, I remember hearing that there was like a quick test with a coin, or is it with a magnet that you can do to see, but I feel unconfident if I remember if it was magnetic, if that meant it was lead or not. Do you remember, Kristen?
If it's if it doesn't stick, I don't think a magnet
Oh.
sticks to lead.
All you need is yeah, there's a link here. I'm gonna put that in the chat if we could share it. But yeah, it helped you quickly to sort of see if there was a chance that that you had lead pipes. So put that in here. The
There's
EPA
also a question in the chat as well, if you wouldn't mind going back to the contact info so people can reach out to you guys.
yeah.
And that's from Scott Sidlow.
I don't know, Sue or Becca, if you could put that link I just put in the host chat and for the attendees at large for that quick test. But yeah, it is definitely a very important resource to talk to your water supplier.
And we do have a hand up from David Director, so we'll bring him over now to ask his question out loud. David?
Yeah, I just wanted to mention regarding the magnet test. A magnet will stick to a cast iron service pipe, which most of the newer pipes are, whereas it will not stick to a lead pipe. And I suspect that's the origin of the magnet test. That said, I wouldn't, I wouldn't bet on that being the best way to find out. I'd go and contact my water supplier.
Perfectly said. Thank you, David.
Okay, it doesn't look like we have any other questions. So at this time, I'll turn it over to Sue to close us out.
Thank you, Becca. I again would like to thank our wonderful speakers and all of you who participated in today's session. Following the close of this session, you will be asked to provide your feedback to our speakers in a brief Zoom survey. We appreciate the time it takes to complete this form, but it is extremely important as the details in this presentation have been. The next session in the 4th Annual Sustainability Conference, titled Green Spaces as a Cornerstone of Sustainability, will take place in just a short 30-minute span from now at 4:30 this afternoon. If you did not sign up prior, please visit our website, www.delcopa.gov/sustainability/conference to sign up. Finally, we would like to invite all of you to attend our closing keynote celebration this Saturday, June 14th, at the Lazaretto in Tinicum Township. This event will include a breakfast and a keynote presentation from a very legendary local celebrity, meteorologist Glenn the Hurricane Schwartz. Sure many of you remember him from television. And we will be also doing an EV Expo and networking with more than 30 local organizations. In addition, there will be museum tours in the historic Lazaretto Quarantine Station, which is a fascinating building in and of itself. And those museums are the Italian Museum, which I'm just a little partial to, and the Swedish Museum. So we'd like you to come over and attend this presentation. Walk-ins are also welcome. And I again thank everyone for your participation in all of the events in our 4th Annual Delaware County Sustainability Conference. And I wish you all a very good afternoon. Thank you.
Thank you.
Thank you.